Okay. So we're having our, I don't know, 437 millionth Friday Zoom coffee chat. It seems like we've been doing these for months. And, you know, we try to get somebody to come and tell you something we find relevant or fun or interesting. And I think AJ's all of the above. Um, so she is with Pace at Home, and I'm not going to do a big explanation of any of that because she's going to tell you all about it. So I will just let you take over at this point, AJ, and you can talk about yourself and what you guys do. And then if people have questions, do you care if they ask questions as you go?
That's fine.
Okay, so if you guys want to ask questions, just unmute yourself and ask questions. That'll be fine, but just try to mute yourself back so we don't have a lot of feedback going on in the background. I'll let you take over.
All right, so I'm going to go ahead and share my screen first and talk while I'm doing that. Hopefully it will. It actually says host disabled participant screen share, even though it looks like it should allow me
Try it now.
Aha, there we go. Now I just got to find it. All right. Come on. All right. Let's see here. All right, so here we go. So I am AJ Kerley, and I am with Pace at Home, and I am their Director of Professional Relations. I've been with them, this coming March will be 5 years. So I love this program, and you're gonna be able to tell that with the way that I talk about this program today. I usually ask questions about what you already know about Pace at Home, but I'm not gonna do that right now because yeah, I'm just not going to do that. I'm going to pretend like nobody knows about Pace at Home, and we're going to go from the beginning. Okay. So the first thing I'm going to do is tell you where we're located. This beautiful building that you see right now is located in Newton, North Carolina. It's actually very interesting how our address works. We're a Newton address, but across one side of Fairgrove Church Road, that's Hickory, and then across the other side of 70 is Conover. So somehow we ended up with a Newton address. But anywho, if you are familiar with this building, most people know this building as the old Dale Jarrett NASCAR office and museum. So we have, over the past 9 years that we have been open, we turned it from a NASCAR environment to a skilled nursing environment, which people find very interesting how that works, but it does work for us. And there'll be a few pictures of the inside as I go along this presentation. And as April said, feel free to ask questions as I go, because there is a lot to this program. And it can be very confusing to some extent. So I will try to speak as slowly and as clearly as possible so that everybody grabs what I am speaking about today. So the one thing about us is we consider ourselves the champion for seniors wishing to remain in the community. It's all about keeping people out of nursing home environment. So that is the goal and the purpose of our program. So first of all, what is PACE? PACE stands for Program of All-Inclusive Care for the Elderly. So it is a community-based program that has a managed care side to it. It provides all-inclusive, medically necessary care for the individuals that are enrolled. We are not only the providers of service, we are the insurance provider for those that come onto the program. So when somebody comes into our program, the first day they enroll, they're going to get a PACE insurance card. We become the insurance payer for everything medical that is needed for them. So we don't have to worry about Medicare or Medicaid cards or anything like that to present to anyone outside of our facility. We take care of all of that billing. The other aspect is we are a village of services. It's not just about what we do inside our facility, but we partner with probably 125 to 150 healthcare related organizations within the communities we serve in order to be able to pull off this program. It's not about just what we're doing on the inside. So we do things in the home as well as through specialty services outside of our facility. So who qualifies for our program? You have to be at least age 55. You must meet the state of North Carolina's requirements for nursing home level of care. And there's kind of a fine line for that. We do have some people that have come in that probably would have been considered more assisted living level of care, but the state has allowed them to come into the program, and they benefited very well from coming in at that stage versus waiting until they were classified as nursing home level of care. So we're looking at those individuals that obviously do not want to live in a nursing home setting or assisted living setting at times, and they want to maintain that life in the community, in their own current residence. So the third criteria of who we are serving, they have to be able to safely continue to do that. That's with the environment they're in, that's with their care support outside of us. We have to make sure, because we are not a 24/7 opened facility. We don't have any overnight beds. Nobody lives with us. We have to make sure they have some sort of care support in the community, even if it's just one person that is looking out for their best interest and can reach out to us should there be a need in the after hours of our program. And then, of course, they have to live in the areas that we serve. So I don't know with those that are on the call where you currently live. So I've got zip codes here. All of Catawba County zip codes we were given by the state. We were only given parts of Alexander. For some reason, they did not give us Hiddenite. For Caldwell County, we go as far as Granite Falls and Hudson. For Burke County, we go as far as Hildebrand, Conley Springs, and Valdez. And then we cover portions of Lincoln County, which are Vail, Denver, and Lincolnton. We have put in a bid, and this has been a couple years ago, to get approval from the state to expand all the way to Morganton and all the way to Lenoir. That keeps getting pushed back, and when the COVID-19 hit, that got pushed back even more. So the new date to hear about that approval is April the 1st of this year. So I'm hoping that date doesn't move anymore, because we are getting calls all the time for people that live in the areas we don't cover that we hope to cover soon. So those are the zip codes we cover at this time. You know, we have a lot of calls coming in, so we know the need is out there for us to expand our service area.
Can I ask a question?
Yes, sir.
I didn't see Lenore zip code in.
Yes, Lenoir is not on there yet. That's what that expansion request is for, is to get Lenoir covered through our program. So that's what we're waiting on. The state decides when we expand, and right now they've not allowed us Lenoir yet. So you have to live in Granite Falls or Hudson at this point, unfortunately. So, but as soon as we get that expansion approval, I will definitely get the word out really fast that we are good to go. So with the way that our program works, it's not about one person dictating what your plan of care would look like. So individuals that come into our program are thoroughly assessed for what their needs might be once they come in the program. And you see all these disciplines or departments around this, this graph here, whether it's nursing staff, activity staff, dietitians, we have occupational, physical, and speech therapy within our building that's making that decision as well. We have our center manager, which is also a nurse. We have CNAs in the building. We have transportation specialists that are transporting all of our participants to and from our facility, as well as to outside specialty appointments. We have primary care providers. Currently, we have 2 doctors and 2 nurse practitioners overseeing the care of our participants. And we have a social work department. We have 4 social workers that help handle families' dynamics. We're trying to take care of the whole person, whether it's the spiritual, the physical, emotional, or mental aspect of these individuals. Social work helps to make sure everything's okay. You know, just because somebody's acting different doesn't mean it's a medical issue. It may be a home environment issue. So they are very good at figuring out and helping families deal with certain things that are coming along. So this team gets together every day to talk about our participants and the needs that they have. As requests come up from families or participants themselves, or as medical needs arise, they all get together to decide what is appropriate for these individuals. Each care plan we put together is individualized. We're not all put in the same bucket. So if you have COPD, you're not grouped in with all the other COPD people. You're all individualized with how we care for you. So the all-inclusive medical approach, here are some of the things listed that we look at. And these are, I mean, it's a lot listed, but there are many more things that we look at too. So you've got your therapies, your nursing, your labs, your primary care visits. We work with Meals on Wheels and other meal programs as well to make sure people are getting the proper nutrition. We have counseling services, whether it's psychiatric specialty services or whether it's just one-on-one or group therapy, we offer that as well. Our CNAs are in the building to make sure everything is taken care of. We do prescription drugs, social services, hearing, eyes, nose, ears, it's head to toe. We're taking care of the whole person. So you see many things listed there, and there are several things that I didn't list that we take care of as well. So we want to make sure that we're not focusing on just one aspect of the person. So that care plan is going to make sure it entails everything to make sure that person is able to live safely in the community and thrive as well as they can. So one of the additional aspects that we offer for our individuals in the program is medical transportation. So you may see these types of vehicles around the 5 communities that are 5 counties, excuse me, that we serve. Right now with COVID restrictions, we're only allowed to transport 1 person with 1 driver in the vehicles. But at times, you know, there were multiple people within each van, and we have 18, I believe, vehicles at this time that transport people wherever they need to go from a medical standpoint. We do not do transportation for groceries or things like that. So that is left up to the family or care support outside of us. But these, our vehicles are on the road all the time from 6 a.m. till 6 or 7 p.m. because we have a lot of people that are part of dialysis that need to get to those early morning appointments or those late evening appointments. So as I said, there would be some pictures here. This is our day health center. We currently renovated a little bit and made the floor completely tile. It used to be broken up with tile floor as well as some carpet. So now it's completely tile. We have tables spread across the entire day center with, as you can see, recliners there for those that want to relax and watch TV. We have TVs throughout the day center for those that they can watch movies or news or whatever they choose to. Also, within the last few months, we have expanded our bathrooms in this area and added additional bathroom access in the day health center, as well as in other areas of the building. So this is a pretty huge, the biggest part of our building. It's the front of our building. So when somebody would come to visit, when we were allowing visitors and tours, this is what you walk into. You walk into the huge room where the majority of our people would congregate. And this is a place where their activities and meals would be done for all of them. Here's part of our therapy department. It wraps around the wall that you see there and continues back there. This is where wellness is done. All the therapies are done in this room for those that come into the center for those things. There's, if you look towards the right of the wall with the cabinets, that is that area where we do personal care for our individuals. We have a women's area and a men's area for showers and other things like that. And there are additional bathrooms there. The next room or the next department is the medical clinic. So we have expanded it. The top picture shows you to the left 2 exam rooms, and to the right you will see stations for our nursing team and providers as they need to utilize those. The bottom picture shows you the back room that we have actually added 2 sick rooms for. In the very, very back, you'll see those sliding glass doors right there that we are using for those that are sick so that we can get them back there, isolate them and treat them as needed when things come up, especially with COVID. Those are rooms we're using for that if we suspect somebody has symptoms geared towards that. So The clinic is hopping most of the time. There's not a dull moment in there. We're obviously we're taking care of individuals that have all different kinds of diagnoses. So we are very busy taking care of our participants to keep them as well as possible. So the one thing that I definitely wanted to give you an update on is what we did and are still doing since COVID-19 hit. Obviously, we could not shut our doors. We have to take care of our people. The responsibility is upon us 365 days a year. It doesn't matter what pandemic happens or what weather happens, or if they go on vacation or out of town for any reason, we are their responsibility. They are our responsibility, excuse me, and we are their insurance provider. So if they go out of town and they have an incident happen, they just have to tell us where they are, and we coordinate and help manage them and partner with the place that they are, whether it's a hospital or urgent care or whatever. And we make sure that those bills come to us and not the participant. So when COVID-19 happened, we had to adapt, and there are several reasons why. First thing is we still don't, we could not allow non-essential visitors in the building, and we still don't allow that at this time. We had to decrease daily attendance in the day health center because we were bringing in about 100 a day and transporting them in, and we had to decrease that to about 15 to 20 participants because you cannot social distance 100 plus people on top of the employees. So we also had to decrease staff in the building at one time as well. We have currently been able to space out all of the tables where we can have a certain amount of individuals, up to 36, I think, come to the day center on a daily basis, and they're socially distanced appropriately. And we're all required to wear masks, participants as tolerated, because we have some that are not able to keep on their mask for most of the time cognitive reasons, with dementia or something like that. So, but yeah, we had to drastically decrease who was in the building all at one time for staff and participants. And we're still doing that. We're not increasing numbers at all at this time. Therapy staff were able to adapt, and they started providing wellness in homes. One-on-one wellness sessions are being provided in the homes. Medical staff, although we're still serving some participants in the clinic, we are also able to go out into the homes as well to do assessments, and our nurses are going out there to see if that person needs to come to us or if they need to go to the hospital for anything. So we're trying to decrease the amount of transport we're doing to our center to keep that decreased attendance in the center down as much as possible. Activities, they adapted, created a virtual calendar along with providing one-on-one activities to participants in their home as well. Also, because participants were not coming in like they were before and getting meals throughout the week with us, we created a food pantry. Our dietitian and nutritionist got with her team, and she created a food pantry, which changes from month to month depending upon the donations we receive from staff and communities and community support. So what she is doing is working with other departments, specifically mostly social work, to determine who in our participant list has the biggest need right now. So we try to prioritize who gets the groceries, when they get them, how they get them, and we're delivering meals, warm meals as well. We're still working with Meals on Wheels in the various counties we serve to provide frozen meals and cooked meals as well. So there's a lot going on with partnerships and inside our program to make sure our people are still getting the nutrition that they need. We're getting ready on February 12th to have another blood drive and food drive to replenish not only our food pantry, but to also support the blood needs out there in the community. One thing that happened October 2020, we have a lot of home care and home health partnerships in the community that have taken care of our participants for the last 9 years. But we were able to also acquire our own home care license, which allows our own CNAs and our nursing team to go into the home as well. So in conjunction with our partnerships, we are also going in to serve our participants in the home versus them coming into the center. So if somebody needs labs drawn, if they need oxygen changes, trach changes, a doctor to come out and assess them, we're able to do all that in the home versus especially if they're not feeling well, versus trying to get them on one of our vehicles and transport them into the center if they're not really feeling up to that. So it's awesome that we got that, and it's been a blessing to have that license now. We're actually looking to also get approval for our therapy department to not only be able to do wellness in the home, but to actually do therapies in the home. So that's the next approval we're waiting on. So I'm excited to see when that comes, how that helps us even more. So I'm not completely done, but I just wanted to say from an admission standpoint, we're still working with new families. We've been doing admissions to our program with new families the whole entire time that COVID-19 has been here. Our intake department, they have to go through their screening tools to make sure they're not doing home visits with anybody that's sick, and they're wearing appropriate PPE, mask, and anything else they need to wear. So we're still working with new families as the needs arise. Our phones have not stopped ringing. They did decrease the first couple of months, but they have picked back up, especially after the holidays. So one of the biggest messages I had to get out, probably summertime, was I was hearing that we were closed and we weren't admitting anybody else, and that is not the case. So we've been able to probably admit 1 to 2, sometimes 3 families per month that we're able to come alongside and help their loved ones. So our doors are open Monday through Friday, 8 to 5, for our participants to come in person as needed. And then we are accessible to our participants 24/7 via phone. An on-call triage nurse is available, as well as a provider, so that if anything happens outside of our office hours, we are able to still take care of those needs and provide services, as whether it's a med or whether they need to go to the hospital, whatever is needed. So it's a lot to the program. I wish we could do tours, but that's not happening right now. But it is an awesome model that I'm glad that we still have in this community. There are a lot of communities across the state and United States that do not have a PACE program to reach out to. So they have to move their individuals into a long-term care facility or try to take it on by themselves at home. So we're very proud that we have been able to continue to stay open during this time and serve the community in our current participant enrollment that are enrolled. So I will unshare my screen and see what questions you have. Maybe. Oh, here we are. Let me see about getting my screen back up. I'm going to try to unshare my screen. Here we go. Got it. Is that the wrong spot? There we go. Hello, everybody. I know that was a lot. If you live in Lenoir, I know it's unfortunate that we don't cover Lenoir yet, but I really feel optimistic that we will get word later this year that we will cover, especially given the certain circumstances over the last 10 months. So any questions?
Is there a cost?
Yeah, that would have been a lot of slides to put the cost on there, so I didn't want to put that on there.
Okay.
But the program is funded by Medicare and long-term care Medicaid.
Okay.
As far as a cost to the participant, that is decided by the DSS in the county that they serve. They look at their income, assets. If their income, I think right now it's every month they are allowed to keep up to $1,060 a month. Anything over that, so if somebody makes $1,200 a month and gets that in income, the state says they have to give us the overage every month. So that'd be what, $140. My math is really bad right now. So $140 a month. If somebody makes more than that, let's say $1,500 a month, then their patient monthly liability would go up. They just subtract $1,060 from that. If somebody has a lot of assets, a lot of money in the bank, we typically refer them, if they don't already have this, an elder law attorney that specializes in protecting money or Medicaid, getting qualified for Medicaid and still protecting money. So we send them to experts that can handle those types of questions. We do have people that pay privately that they just have Medicare. I think this year, I have not heard what the monthly is this year, but I know last year it was about $4,200 a month for our program for somebody that's paying privately, which in the grand scheme of things, I know that sounds kind of high, but for one, if they move into a nursing facility, it's going to be a whole lot more on a monthly basis.
Yeah.
Two, if they go to a specialist, a hospital, they have meds that cost $1,000, $2,000, $3,000, which some of our people do. They have dialysis, those kinds of things. All that's included. We don't ask for extra money if something extra gets added to your plan of care. So that's just a one-time first of the month payment. For those that don't have to pay anything and have Medicare and Medicaid, which actually it works for everybody. Medicare and Medicaid, if they're the two insurances, they send us a monthly capitated reimbursement based on the medical form we sent the state in the beginning. That payment typically doesn't increase very much, or if at all, if they get sicker. So we are financially responsible and liable for each one of these individuals, and we take that financial risk. We are a nonprofit. A lot of people don't realize that. So we don't get any other funding unless somebody donates to us outside of those two insurance companies. So it doesn't matter if somebody needs a lot of care or just a little care. We're responsible for them no matter what. If at the end of the month, somebody's bucket per se doesn't have money for a surgery that's medically necessary, we do it anyway. Because if it's going to help our individuals thrive and continue to live at home, we're going to do it anyway. So we don't have to go back to Medicare and Medicaid and say, can we do this? It's up to our team to decide what's medically appropriate for our individuals. So that was an excellent question. And each family is different. So intake talks to them about what those financial responsibilities might be, if any, and how and what that looks like. So we definitely don't leave that we don't leave that up in the air for somebody else to decide. We definitely start that conversation really early on, so everybody knows what's going on. Any other question?
AJ, for the intake process,
Yes,
if somebody calls you, how long does it typically take before they're able to start getting services? Is there a waiting list, or?
There's no waiting list. With the process, intake is looking at, we have to get medical records from their current providers. They have to do an FL2 form, which is the medical form our doctor fills out and sends to the state. They have to come in for that. Then they have to come in for the other department assessments. So therapy has to assess, social work, activity. Everybody's got to assess to formulate that care plan. We have to get approval from the state, which usually doesn't take very long. The biggest piece is if somebody is wanting to utilize the long-term care Medicaid, it's getting that process done. You have to have all your stuff in order. Medicaid looks back 5 years. And sometimes they find stuff that we weren't aware of until they find it. So that's typically the longest process. So let's say we're starting with somebody right now, somebody called today and wanted to be in our program. They qualified. The assessment process typically takes a day and a half, maybe 2 days. To do that, we have to do a home visit for safety purposes. That's usually one visit, unless we see something that's concerning. If they started today and they had Medicaid already, maybe there just need to be a clerical thing, one statement brought to the DSS. It would be close, but maybe February 1st. More than likely, it would be March 1st, because the state only allows us to enroll people the first of each month. So it's not a crisis moment direct admit like you would for long-term inpatient living in a nursing home, unfortunately. So, and somebody that's private pay, we can do assessments and bring you in.
That's only a day.
Yeah, we can bring you in much quicker because it's just assessments. There's not insurance involved. So.
Is that only a day program?
We do have the adult day piece of it. Obviously, right now that is prioritized based on need to come in because we're trying to keep numbers down. But with it being an all-inclusive program, that's just a piece of the puzzle. Somebody that just wants adult day services, we refer to adult life programs or
Well,
whoever might be closer to somebody in their county.
what does all-inclusive exactly mean then?
What that means is everything medically necessary to care for you is covered.
But
key-
in your home or at base?
Both. Everything. Anything possible. If you need something at home, if you need something that be done here, it is everything. And that's all talked about before somebody gets started. It's like, what services do they need? Do they need just to come to the center with specialty visits, maybe outside, like heart doctor or a lung doctor we need to take you to, or do they need assistance at home as well? So we look at everything from the home until and also in the facility. It is literally everything. There's no catch-22. It is everything.
I must have been sleeping or something. So do you have beds there for at night, or is it only a day program?
Yeah, it is. We are not a nursing inpatient facility. We are just considered an outpatient. So there are no overnight beds here. If somebody needs that type of environment, then we refer them to a nursing home setting where they would go and live, unless their care support can take care of that overnight stuff and stay with them.
And do you have any favorite nursing homes that you refer to?
We have partnerships with every nursing home in Catawba County and at least one in every other county. So there's not necessarily that it's favorite, it's those that are in network contracted with us is who we work with.
So they have to be contracted with you.
Yeah, they have to be contracted with us. If I don't have a contract with one, then I will seek that out if our team believes that we need that partnership. That's part of my position as well, as I work with all of our partnerships and acquire new ones as we need them.
Thank you.
You're welcome. Anybody else?
Yeah, that large area that you have with the chairs and the televisions and stuff like that, is that essentially a waiting area for people who are waiting for treatment, or
Well, that's a space where they're able to engage in activities. They're able to, we have a triage area out there that I don't think was in the picture, that if they need meds during the day, the nursing staff is there to do meds. If they need oxygen treatment while they're out there, that area is there for them to do that instead of coming back to the clinic. When we were doing volunteers coming into the program, we had groups come in to sing to them. They brought in karaoke. There would be shows that would come in, like theater, plays, things would come in. Outdoor volunteers would do bingo with them. We currently don't have any volunteers doing that type of thing, but we do activities throughout the day, depending upon their cognitive level or their dementia diagnosis. We do different things one-on-one or as a group. Obviously social distance right now, but that is an area also where they would get their meals and snacks throughout the day. Transportation would pick them up in that room and drop them off in that room as well. That's where they spend the majority of their day. If they need therapy while they're here and they're scheduled for it, they're just walked back to the back to get those things. Or if they need to go to the clinic for anything, then a CNA will walk them back for the clinic services. So it's a place to hang out, spend time with other participants, and be engaged throughout the day. But I wouldn't really call it a waiting area because they're engaged throughout the day and kept busy. Because with demented ones, especially, they don't know what time it is. So we have to keep them engaged so they don't want to go home as soon as they get here. So we make sure that they are engaged as much as possible throughout the day.
so then some of your clients, I guess, they come and just socialize there.
Sometimes it's just it's because with some of our participants, the reason they are still continuing to come in, they may have essential workers in their home, and if they have dementia and cannot be left alone, they need a place to spend time and hang out while their loved ones are at work. So we become that place for them, that safe place for them to come and keep, like I said, keep them engaged. And if they need something medically or therapeutically or from a social work standpoint, we have that here and don't have to take them anywhere else for those services. We can do it here.
I have a question. I don't know if you can hear me.
Yes, ma'am, I can hear you.
Okay, I came in late on the call, but I'm just wondering, is transportation provided for those who need it to get to the PACE Center?
Yes, ma'am. We have medical transportation that does to and from their home to us, and also takes them to all medical appointments outside of our program.
Okay. Okay.
Is that Mary Gordon on the phone?
It is.
Okay.
Hey.
We have we've also recorded this session, and it'll be posted on our Senior Center YouTube page. So if you want to go back and see what watch what you missed, you can do that. It'll be up probably sometime this afternoon.
Okay. Thank you. And I don't know if you have the liberty to say who you have a contract with in Caldwell County in terms of long-term care centers, but if you could answer that question, I'd like to know which center it is.
It is Hickory Falls.
Hickory
Falls.
Falls.
Okay. Yep. Yeah, they're
Thank you.
Yeah, they're in Granite Falls.
Okay.
Do your contracted facilities currently have to be in the zip code that you're serving?
Yes and no. We have two right now, and I just acquired one yesterday that we are able to contract with just for short-term stays.
Okay.
So if somebody needs respite, or like, if we have somebody that would develop COVID, we have places to be able to send them short-term. But no long-term. If somebody were to roll over into long-term because of safety issues or their condition got to be too much for the caregiver at home, then we could place them long-term, but not in and outside the area. If we do it outside our service area, they would have to come out of the program. We could not be that managing support anymore.
Okay. Thank you.
You're welcome. Anything else? The one thing I will say, we're always accessible for questions after this. April, you have my contact information and can share that if you need to. So we're always here for questions, because questions come up, and as people are watching this recording later on, please reach out to us. Let us know if you have questions, how we can help, because we don't know all the needs out there unless somebody calls us and tells us. So. But we're here to help, and if we're not the perfect fit, we'll give you a resource of somebody that is.
Thank you so much for coming and talking about this, and we look forward to having you back when you are able to expand into that Lenore zip code, because I think that'll even bring more people into that are interested in the services, because I know we get calls about people who are very interested but don't quite fall into the catchment area just yet. So hopefully that date doesn't get pushed back anymore.
I hope not, because we're getting probably more calls in the last 10 months with what's going on right now. Mm-hmm. So we really want to be able to serve the areas we are still at. It's not too far for us to go to Lenore or Morganton. Yeah. So we really want to get approved for that. So.
Well, thank you so much for coming, and thank you guys for coming. We did have some Catawba County guests today as well. So we've actually partnered and we're working with Vicki to in Catawba County to share these with participants in Catawba as well, so we can spread the information as far as we can. So, but thanks everybody for coming, and I hope everybody has a great day.
Thank you for having me. It was a pleasure. Thank you.
Thank you.
Bye, guys.
Thank you.
Bye-bye.
Have a good day.
Bye.
Bye-bye.